हेलो फ्रेंड्स, आज के इस लेक्चर में डिस्कस करेंगे एंटीकोगुलेंट एंड देयर यूजेस के बारे में। हमारा जो ब्लड टेस्ट करने के लिए ब्लड कलेक्शन किया जाता है, उसी वक्त डिफरेंट टाइप्स ऑफ वाइल्स पे ये ब्लड कलेक्शन किया जाता है, जैसे कि रेड टॉप वाइल, ब्लैक टॉप वाइल, ग्रे टॉप वाइल, पर्पल टॉप वाइल, ऐसे बहुत सारे वाइल्स पे ब्लड कलेक्शन किया जाता है। लेट्स अंडरस्टैंड हाउ देयर वर्क्स and how they are preserved with blood. Anticoagulant. When blood is collected, it clots after some times. The anticoagulant are the chemical agent which preserve or which prevent the clotting of the blood when mixed with blood in proper proportion. Then, purpose of using anticoagulants. For study various constituents of blood components, study of coagulation, that means clotting of blood defects, and preservation of blood in blood bank. Then characteristics of anticoagulants or characteristics of ideal anticoagulants. An anticoagulant selected for use in hematological examination must have the following qualities. It must it must not alter the size of the cell, it must not cause hemolysis, it must minimize the platelet aggregation, it must minimize the destruction of the staining and morphology of leukocytes. It must be readily soluble in water. It should be soluble in blood. It must be keep the blood in fluidic condition. Then coagulation phase. There are two major pathways. That means first is intrinsic pathway and second is extrinsic pathway. Here is the two pathway in which blood clots. There are 13 soluble factors are involved in the clotting process. These anticoagulants act on these factors that breaks down the coagulation pathway and break the coagulation. Then classification of anticoagulants. There are two types, calcium chelator and second is non-calcium chelator. Calcium chelator means it binds with the calcium and coagulation pathway breakdowns. The non-calcium chelator, it do not bind with calcium. Under non-calcium chelator, there are two anticoagulants. One is heparin and second is warfarin. Under calcium chelator, there are oxalate. Under oxalates, there are three types: ammonium oxalate, potassium oxalate, and double oxalate (EDTA), ethyl diamine tetraacetic acid, and trisodium citrate. Most of the anticoagulants used in laboratory by bind with the calcium and prevent clotting of the blood. Commonly used anticoagulants are EDTA, oxalate, sodium heparin, sodium citrate, sodium fluoride, and potassium oxalate. The anticoagulants used in the blood bank are ACD, means acid citrate dextrose, CPD, and citrate phosphate dextrose, then CPDA, citrate phosphate dextrose adenine. EDTA, ethyl diamine tetraacetic acid. EDTA is the most frequently used anticoagulant. It's an amino carboxylic acid and a colorless water soluble solid. Types or forms of EDTA. There are two types. One is trisodium, that means K3 EDTA. The second is disodium EDTA. Mode of action: it forms insoluble salts by the chelation. Its concentration 0.5 to 2.0 mg EDTA per ml of blood for at least 6 hours. Advantages: making a blood smear for morphology studies, uses for the test for the CBC, microfilaria, COMS test. EDTA preserve the staining and the morphology of leukocyte. Disadvantages are excessive concentration of EDTA will cause shrinkage of the RBCs and that will affect the PCV, MCV and MCHC result. EDTA interface with the blood chemistry test follows falsely decrease alkaline phosphatase by binding magnesium ion. It decreases CO2 binding power of blood. It interferes with the Jaffe reaction for creatinine test. It decreases or alters sodium, potassium, calcium ion in the plasma. Oxalate. Mode of action. This acts by the chelating of calcium. Calcium oxalate is formed by insoluble precipitate. These are used for the blood chemistry and hematocrit. Its types potassium oxalate and ammonium oxalate. Potassium oxalate is used as its used a concentration of 2 mg per ml of blood. This anticoagulant is the most often used in chemical analysis. Advantages: potassium oxalate shrinkage the RBC above an 8% shrinkage the PCB, therefore PCB ESR not recommended. Double oxalate. Double oxalate uses for the ESR and hematocrit. Concentration: potassium oxalate and ammonium oxalate are used together in the ratio 2:3. This is done to counter the swelling effect of ammonium oxalate and shrinkage effect of potassium oxalate. Advantages: double oxalate can be used for hemoglobin, TLC, RBC count, ESR by Wintrop's method. Its disadvantages are leukocyte morphology not well preserved, hence most not suitable for PA studies. That means peripheral smear studies. The calcium chelates is precipitated in the calcium oxalate, which is toxic substance. It's not. It is never to be used for blood banking application. Then heparin. It is a natural anticoagulant in our body, found in the liver and also maybe with the basophils and mast cell. Heparin also called as antithromboplastin or antithrombin. It is available in the liquid or dry form as sodium, calcium, ammonium, and lithium salts of each will interface with the demonstration of their respective ions in the plasma. Its mode of action: it interfaces with the formation and the activity of the thrombin and activity of clotting factors like 9th, 10th, 11th, and 12th. The optimum concentration is 0.1 to 2 mg per ml of blood. Disadvantages are it causes clumping of leukocyte, it interferes with the staining of leukocyte, it's the most expensive anticoagulant. Blood clots in 8 to 12 hours because clotting is only delayed, not prevented. It is not suitable for agglutination tests and coagulation studies. It may interface with the automated biochemical analysis of plasma. Then sodium citrate. The formal citrate solution is used as diluent in the counting of the RBCs and platelet. Its concentration 3.13 grams of trisodium citrate is dissolved in 100 ml of water. 1 ml of formaldehyde is added every 99 ml of solution. Mode of action: it combines with the calcium to form insoluble salt of calcium citrate. Its concentration is the standard concentration 1 part 3.8% per 9 part of blood. Advantages: sodium citrate is the anticoagulant for choice of studies, platelet functions, and morphology. Disadvantages are it interfaces with the many chemical tests used along it. Used along it preserves blood only a few minutes. It has a tendency to shrink the cell because 10% dilution of the blood and sodium citrate is generally not used for CBC. Then sodium chloride and potassium oxalate mixture. Its mode of action: sodium chloride inhibits the glycolytic enzymes responsible for the breakdown of the glucose in the blood. At room temperature, at about 10% glucose is lost per hour from an untreated sample. The potassium oxalate is the primary anticoagulant, as sodium chloride has a poor anticoagulant effect. Optimum concentration 1 milligram of mixture per 1 ml of blood. Uses glucose determination. Disadvantages: it is poisonous. Inhibition of glycolytic enzymes may be interfere with the urea and glucose determination that employ enzymes activity. Alkaline phosphatase, amylase, uric acid cannot be determined in the blood containing sodium chloride. Here is the various color codes tubes commonly used in the hematology. Red top tube, no additive or no anticoagulant. Used for the blood bank, some biochemistry collects used for collection of the serum. Then 10 to 15 minutes is required to allow by the centrifuge method we get the serum. Then lavender or purple cap, the anticoagulant is EDTA, collection of whole blood. It acts by calcium chelation. And then green top file, sodium or lithium heparin. It inhibits thrombin activation used for the chemical studies. Then light blue top file. The anticoagulant used is sodium citrate. It is used for the coagulation studies like PT, aPTT. Then gray top file. Sodium chloride and potassium oxalate that inhibits enolase enzyme that will prevent the glycolysis. It is used for the glucose estimation in the biochemical studies. Thanks for watching. Please like, share and subscribe for the latest updates.